live on the Be Live platform, a platform I'm very grateful to have. Thanks to everybody that supports the show. Keeps me rolling. We got a big show today. As you can see in the headline, medical errors kill approximately 250,000 Americans annually. So far, even the most doomy and highly suspect statistics say COVID has killed only 203,545 people worldwide. And most of these people are elderly and have several comorbidities, several other serious existing medical conditions. Put into perspective, global poverty kills approximately 8 million children annually, and the absurd COVID response is forecast to drive 500 million more people into poverty. Maybe we should take a less myopic view, explore the big picture, and reopen the planet. That's my perspective. It's my opinion. It's only my opinion, so take it with a grain of salt. Take everything you read with a grain of salt, especially if the people selling it to you are turning a profit or are heavily supported by governments, NGOs, corporate pyramid schemes, etc. What's up, fam? It's me, your boy Max Mogren. This is Wake Up Wyoming. It is April 26th, 2020. Dreary day here in Alpine, Wyoming. I hear rain falling on the metal roof upstairs. What's up, Julie Ray? What's up, Johnny OD? Thanks. I am trying to look sharp, Maybe I should trim the beard, cut the hair, but I don't know. I think I like having a beard. I like having a beard and some wild hair, and easy to look sharp. Just put on a suit and tie, or suit. Nice collared shirt, whatever. There's Mike Rupert. He's got the big burger there for me. Probably shouldn't have eaten that. I'd say if you eat a burger like that every day, your odds of dying due to heart disease are a lot higher than your odds of dying due to coronavirus or anything else. Let's get into it today. I got to say, recently, I've been catching a lot of flack from friends who are in the healthcare profession. Okay, they think they're taking it like a personal attack. They think I'm going after doctors and nurses, which couldn't be any further from the truth. In the last couple of days, I was on the cover of the local paper protesting. I don't know where that paper is, but people are all fired up. People think I'm attacking individuals. Don't take it personally, please. I'm not trying to attack anybody. I'm trying to raise awareness and information. One close friend told me that I should take a look at Time magazine. So I'm going to go ahead and shred Time magazine today and their coverage of the COVID situation. We're seeing all sorts of new studies come out. This one was published only 3 hours ago at Axios, and it gives us a glimpse into the situation as a whole. 3 hours ago, Axios Health, 96% of 3,300 inmates with coronavirus were asymptomatic, survey shows. Okay, this is a fresh survey from here in the United States. 96% of 3,277 inmates in state prison systems in Arkansas, North Carolina, Ohio, and Virginia who tested positive for the coronavirus did not show symptoms, Reuters reports. Why it matters, the findings suggest that asymptomatic patients could be contributing to the spread of the virus at a far higher level than suspected, especially in prisons, which has proven to be a breeding ground for COVID-19. This is especially noteworthy because health officials have prioritized testing and surveillance for people that show symptoms. Okay, it's important to note here, if we do a little back of the napkin math, they're saying 4,693 total tests were conducted. Of those 4,693 tests in the prison systems of these various U.S. states, 3,277 tested positive. I just want to run a quick calculation on that. Pop this up because this will give us, this is not a random sampling, obviously, but it is giving us some good information about how pervasive coronavirus is in the prison system. Of course, we all know that the prison system in the United States is severely flawed. The United States has got more people locked up in prison than any country in the known history of the world. Something like 3 million Americans, close to 1% of the population, are locked up. Another 9 million people are under state supervision, stuff like probation. So, and these prisoners, obviously coronavirus is running rampant in the prison system, as evidenced by this set of statistics. I'm going to divide that 3277 by that 4693 and see what we come up with. Just confirm my numbers there. Yep. Enter. Times 100. Oh, there we go. 69.8%, almost 70% of these prison inmates tested came back positive for COVID, and 96% of these people, folks who are living on prison food, I would imagine in a pretty stressful, not very healthy lifestyle in prison, but still 96%, okay, do not show symptoms. Okay, so important to note that. Just file that away under interesting information. This one, okay, as you see in the title of the show today, 200,000, the global death toll tops 200,000. Now that statistic, that figure is highly suspect, as we're going to get into. I've been covering this for weeks on the show. The World Health Organization and CDC reporting guidelines for coronavirus deaths are highly suspect. But and the mainstream media also highly suspect. The World Health Organization itself highly suspect. Notice this headline. They warn, the World Health Organization warns there's no evidence of coronavirus immunity. It's quite the headline there. It's quite the headline. Fortunately, it's not true. Then first paragraph, they keep the fear porn rolling. There's currently no evidence that people who have recovered from COVID are protected from a second infection, the World Health Organization warned Saturday as the worldwide death toll topped 200,000. The health body tweeted that it was continuing to review the evidence on antibody responses to COVID-19, adding that most studies suggest that people who have recovered from the infection have antibodies to fight the virus. However, some of these people have very low levels of antibodies in their blood, it said. Okay, so right there, we all know basic immunology, basic epidemiology. If you have the antibodies to fight a disease in your blood, you have a certain level of immunity. They're playing games with semantics here. They're saying there's no evidence of immunity, but actually there is, because people have antibodies in their system. To what extent are people less susceptible? Are they fully immune? Apparently not, but the notion that there is no evidence that people have immunity is a funny word. No evidence that people are less susceptible, that they'll have a less severe case, that their chances of having a severe reaction and needing to be hospitalized or dying due to COVID. I'd say if you look at the actual statistics, look at the actual studies, there is plenty of evidence showing that people have a heightened level of immunity after a coronavirus infection runs its course. We'll read a little more out of this propaganda here. Most people who are infected with COVID-19 will develop an antibody response that will provide some level of protection. It later clarified, but it does not yet know what that level is or how long the immunity will last. Okay, so there again, they're implying that there is a level of immunity. They just don't know what it is. And but you read the headline and it makes it out like the whole situation is hopeless, that you're going to catch coronavirus time after time after time, and there's no evidence whatsoever that you'll have any immunity. This is total fear porn propaganda, terrorizing people. The World Health Organization warning. The World Health Organization warning comes as the worldwide death toll for the coronavirus surpassed 200,000 on Saturday, according to a tally by Johns Hopkins, with a total number of confirmed cases worldwide now standing at nearly 2.9 million. In the U.S., they're saying that more than 53,000 people have died from the virus, with a number of confirmed cases nearing 1 million. Okay, these institutions, these statistics are highly suspect. Okay, the World Health Organization, its largest corporate backer, its largest donor, used to be the United States. Now the United States no longer supporting the World Health Organization, leaving the Bill and Melinda Gates Foundation as the biggest supporter of the World Health Organization. Of course, the Bill and Melinda Gates Foundation heavily invests, in their own words, they invest in an initiative. They encourage other wealthy folks and non-governmental organizations and governments to invest. That's right, they use the word invest, not donate, to Gavi, a global vaccine initiative, trying to push vaccines on people all over the planet. Johns Hopkins University also heavily influenced by Gates Foundation, as evidenced by their joint effort on October 18th, 2019, in the Event 201 exercise, which recommended how the world should react to a global pandemic. Okay, what organizations brought this to us? Well, you can see right there. Johns Hopkins University, the World Economic Forum, and the Bill and Melinda Gates Foundation. So it's pretty hard to take the World Health Organization and Johns Hopkins Medical School at face value when we know that they're heavily supported by the Bill and Melinda Gates Foundation, and they in fact helped forecast what the world was going to look like, forecast how the world would respond to the next great pandemic. But these statistics, this 200,000 statistic, they're obviously getting that from the Johns Hopkins University global event doom map, the fear porn map here. If we refresh this real quick, I'm sure they got some new deaths for us, some new total confirmed cases. Let's see, here it comes. Be afraid, be very afraid, friends, because the numbers just keep climbing. We've covered this map extensively. Again, if the financial and other relationships don't discredit this information in your perspective, all you have to do is take a little look at their actual, sorry, it's taking a little while to load up. This is the first time that we've had a map like this tracking a global pandemic in real time. Again, 203,622 total deaths worldwide attributed to coronavirus. But it's important to note, if you read the fine print on the map here, confirmed cases include presumptive positive cases and probable cases in accordance with CDC guidelines as of April 14th. Okay, this is new. I'm going to open that up. I haven't seen this new set of guidelines, so I'm going to save that and get into that after the show here. But it's important to note these cases are confirmed and presumptive positive and probable cases, meaning no test needed for people to make it on the map here. Some of the sources here, obviously the World Health Organization, highly suspect. But you look at all these, DXY, 1.3 acres, worldometers.info, BNO, and the COVID tracking project. None of these sources seem exceptionally reputable to me. I've covered it extensively in the past on the show. So now you know. If you want an in-depth analysis of why these numbers are BS, just take a look at the archives here. But look at this number, 203,622. Those are the most terrifying, most propagandistic statistics we can come up with. And let's do a little math here. 203,622. Oh, fucked it up again. Excuse me. Divided by the global population, which is 7.8 billion people. I already did the math, but I'm just doing it again so you'll see. So that's 7 million. So we got to add 3 more zeros. It's a lot of people. So we multiply that by 100, and that's going to give us the percentage of folks all over the planet that have died from coronavirus. So if it was 1, that'd be 1%. If it was 0.1, that would be 1 out of 1,000. 0.01 would be 1 out of 10,000, and 0.001 would be 1 out of 100,000. So right now we're seeing 2.6 deaths per 100,000 people worldwide. And due to that, again, that's the most doomy, scary statistics that you can find. Those are the ones we're getting thrown in our face all the time. But still, you look at that as a factor of the total population, 2.6 out of every 100,000 people have a confirmed or presumed positive or probable coronavirus death. And again, here it is again, confirmed cases include presumptive positive and probable cases. Death totals in the US include confirmed and probable in accordance with CDC guidelines. Okay, if you look at those CDC guidelines, I've brought that up before. Point is, these statistics heavily cooked. If you look at the actual CDC statistics, the provisional death counts, they're saying 24,555 confirmed coronavirus deaths in the country. If we look at the percent of expected deaths right here, the middle column where I got the hand going, You can see we're for the week of April 4th, we had 9% higher deaths than what we would expect based on data from previous years. The week of April 11th, we've seen 3% more deaths. You can see here on the 18th, 62%. That's because it takes time for the actual death certificate statistics to be processed properly, adding more uncertainty to the official, or not the official, the most doomy, fear-porny statistics coming from the Event 201 associated Johns Hopkins University Global COVID Event Fear Porn Real-Time Doom Map. Again, if you look here at the fine print here below this graph, the CDC deaths with confirmed or presumed COVID-19. Okay, no test needed. Now let's look at this in perspective. Let's put all this into perspective, as it says in the title of the show today. A child under 15 dies every 5 seconds around the world. That I'm getting, from the same folks giving us this COVID fear porn, the World Health Organization. So we got to take it with a grain of salt. But an estimated 6.3 million children under 15 years of age died in 2017, one every 5 seconds, mostly of preventable causes, according to new mortality estimates released by the World Health Organization, UNICEF, the United Nations Population Division, and the World Bank Group. The vast majority of these deaths, 5.4 million, occur in the first 5 years of life, with newborns accounting for around half of the deaths. If you look at this, the world counts, I'm going to refresh that. Child deaths due to poverty, 1,976,565 estimated deaths so far this year in 2020 due to poverty. If we look at this week, 108,782. This month, 431,523. Adds quite a bit of support to the notion that poverty kills, okay? Poverty kills. Poverty much more deadly than the coronavirus. That's why I've been out protesting, because the official responses to coronavirus are driving hundreds of millions of more people into poverty. Again, so far this year, almost 2 million deaths estimated due to poverty. And these aren't deaths of elderly people. These aren't the deaths of people that spent their whole lives eating big cheeseburgers like that. People that spent their whole lives smoking butts, drinking diet soda, and not taking anything remotely close to good care of themselves. These are deaths of children. These are children dying, not elderly, not people with comorbidities, children. If you want to know where I got my statistic, in the title there, where I said 8 million children die annually due to poverty. That was just some simple math here, where they're saying that right here on, sorry, it's getting a little hectic here. Too many windows open. At dosomething.org, according to UNICEF, 22,000 children die each day due to poverty. If you just take that number, 22,000 by 365 days, that gives you a grand total of 8,030,000 children dying every day due to poverty. Is that number exactly right? No, certainly not. But it's from UNICEF, it's from the UN. Poverty kills, okay? Got a lot of stats here. And it's important to note that Oxfam estimates that it would take $60 billion annually to end extreme global poverty. That's less than 1/4 of the income of the top 100 richest billionaires. The World Food Program says the poor are hungry, and their hunger traps them in poverty. Hunger is the #1 cause of death in the world, killing more than HIV/AIDS, malaria, and tuberculosis combined. Important to note here, this is the World Economic Forum, the same folks who were doing Event 201 with Bill Gates, Bill and Melinda Gates Foundation, and the World Health Organization. Even according to them, published on April 9th, the coronavirus crisis could plunge 500 million more people into poverty, according to Oxfam. On top of the ever-increasing death toll, the coronavirus outbreak threatens to push around 500 million people into poverty. Okay. The International Monetary Fund and World Bank annual meeting described the crisis as deeper than the 2008 global financial crash. Now, if we look at annual deaths, I find this odd. This is from Wikipedia. The annual number of deaths by cause, right? This is in millions. You can see if you look at the bottom there, it says millions. It's hard to read that below the crawler, but you can see these statistics are in millions. Zoom in again. And if you look here, you can see that cardiovascular diseases kill 17.65 million people all over the world in 2016. Cancers, 8.93 million people. Interestingly, they don't put poverty on here, even though poverty is estimated to kill about 8 million children annually. But it's factored in here with respiratory diseases, diarrheal diseases, stuff like that, right? It's hard to say poverty killed this person, but I'm just going with the best data I can find online. So we're talking about 200,000 coronavirus deaths worldwide so far. The great pandemic that was used to terrorize all of humanity and put us all into a state of medical martial law, shut down the global economy, driving hundreds of millions, according to Oxfam, 500 million. But I would argue that probably a lot more people than that are going to get plunged into poverty by this situation. 200,000 deaths so far. Put it into perspective. 17.65 million people die every year due to cardiovascular diseases. If we scroll down here, coronavirus right now as it stands would be on par with drowning as a cause of death globally. So don't believe the hype. As it says in the title there today, the number of deaths in the United States, again, recently I've had friends that are in healthcare thinking I'm going after them on a personal level because I'm exposing flaws in the official statistics, because I've been exposing flaws in the standards of care being used to treat coronavirus patients, exposing flaws in the death reporting. This is not personal unless you're like an aide to Fauci, or you're working with Bill Gates, or you're at the World Health Organization or the CDC. This stuff is not directed to you unless you're running a huge hospital. I'm not going after individual doctors and nurses who are just trying to do their jobs, take care of people, save lives, and put food on the table. But we can't overlook the fact that in the United States, medical errors are the third leading cause of death, attributed to 251,454 deaths annually. Put that into perspective, that is 20% more than coronavirus has killed globally so far. This chart confirmed by a May 3rd, 2016 U.S. News and World Report article. 10% of U.S. deaths are due to preventable medical mistakes. Okay, the assistant managing editor of health initiatives at U.S. News and World Report, Steve Sternberg, reported on May 3rd, 2016. People think I'm going after individual doctors. No, man, I'm going after the third leading cause of death in the United States. Medical errors are the third leading cause of death in the U.S. after heart disease and cancer, causing at least 250,000 deaths every year, according to analysis out Tuesday, indicating that patient safety efforts fall far short. People don't just die from heart attacks and bacteria, they die from system-wide failings and poorly coordinated care, says the study's lead author, Dr. Martin McCary, a professor of surgery and health policy at where? Event 201 associated Johns Hopkins University School of Medicine. Its medical care gone awry. The magnitude of the death toll, roughly 10% of U.S. deaths annually, is striking, coming as it does in an era dominated by efforts to reform the healthcare system to ensure safe, high quality, high value medical care. Right. I believe it when I see it. Patient safety efforts have failed to gain much traction, McCary says, because there's no systematic effort to study medical errors or to put effective safeguards in place. Okay. If we wanted to take public health seriously, we could go after heart disease. We could go after autism. We could go after medical errors, save literally millions of lives in the US and all over the world by doing so. Okay, I got another article up here. Let me bring it up. This is one of the, this is later. This is another article that just provides more support for that. Building capacity for health informatics in the future. article published online, open access. Your healthcare may kill you. This is from 2017. Medical errors, written by James Anderson, PhD, and Kathleen Abramson, PhD, and registered nurse. James is at the Department of Sociology at Purdue University, and Kathleen is at the School of Nursing at Purdue University. Recent studies of medical errors have estimated errors may account for as many as 251,000 deaths annually in the U.S., making medical errors the third leading cause of death. Error rates are statistically higher, significantly higher in the U.S. than in any other developed countries, than in other developed countries such as Canada, Australia, New Zealand, Germany, and the UK. This is interesting, though. At the same time, less than 10% of medical errors are reported. Interesting. Gets you thinking. This goes back into the history. Gives you some foundation for where their statistics are coming from. But look at the last sentence of this paragraph. Now they're saying it has been estimated that only 5 to 10% of medical errors are reported. So in their abstract, they say 10%. And then in their introduction, they say it's estimated that only 5 to 10%. So where is it? What's the actual number? We don't know. But this is a good read, worth checking out. They did a study where they tried to implement a new policy for reporting medical errors in a number of hospitals, I think 24 different hospitals all over the country. And this is a good read. I'll paste this into the comments there. Well, I don't know if I can, because it's a PDF, but you saw the title there. If you want to read it yourself, happy hunting. But let's read the conclusion. Over more than 2 decades, medical errors have continued to be a major cause of death in the U.S., as well as in other countries. Despite the mandated implementation of error reporting systems in many states, less than 10% of errors are reported. Even when errors are reported, hospitals fail to take effective actions to prevent their reoccurrence. The current study found that only 15% of the actions that hospitals took in response to reported errors involved system changes. Major barriers need to be overcome in order to improve patient safety. Information technology can reduce errors. Electronic medical records, electronic prescribing, barcoding of medications, and decision support systems have been shown to be effective. Okay, that's stuff like the standards of care, which are highly suspect in my opinion. However, many hospitals have been slow to invest in these technologies. Research is needed in order to make a better business case for investing in these systems in order to improve patient safety. A second barrier to improving patient safety has been the reimbursement system. The current system does not provide sufficient incentives for hospitals and physicians to invest in patient safety. Too often, medical errors result in increased revenue. At the same time, there's too much reliance on the medical malpractice system to prevent future errors. New models that promote patient safety are needed. Okay, so sociologist and nurse, both PhDs at Purdue University, in 2017 published this study. And in their conclusion, they are saying that there is not enough incentive for hospitals and physicians to invest in patient safety. Too often, medical errors result in increased revenue. Catch all that? And on top of that, they're saying only, in many states, less than 10% of errors are reported. Okay, so could the number of actual deaths due to so-called medical errors be closer to 2.5 million? If we just multiply that by a factor of 10, compared to the 251,000 we're seeing here, I don't know. But I do know the medical insurance pharmaceutical cartel is very corrupt. It's very pseudoscientific. It's very profit-driven. And it's more concerned about making money than helping people get healthy. And we also know that it kills more people in the United States every year than the coronavirus has killed globally so far. Put that in your pipe and smoke it. Moving on. Of course, we've been told, back to financial incentives real quick. Important to note here, too, if you watch Dr. Scott Jensen, a medical doctor from Minnesota, my home state, who's also a state senator, he went on the news and said that hospitals have a financial incentive just like they have financial incentives to avoid reporting medical errors, they also have a financial incentive to list, to assume all patients that come in right now are coronavirus patients, to assume that people have the coronavirus, and to assume that deaths from a number of comorbidities are coronavirus deaths. Why? Because there's a financial incentive to do that. Check out Dr. Scott Jensen's comments. If you disagree, if you don't like that, well, there's a lot of things I don't like about healthcare too. But this is a good read. I'll paste this one in for homework. It just gives you a good example of how convoluted and confusing and profit-driven and corrupt the healthcare system is. Because there's this whole matrix of different hospital providers and insurance providers and changing rules. And the bottom line is, you could go into the hospital thinking that your coronavirus care is covered because the government, passed a couple laws, but in reality, a lot of people are going to get tested for coronavirus and ending up with walloping medical bills. In the midst of this whole situation, I got friends and family that are in healthcare. I got close, well-trusted confidants who are on the board of mid-sized hospitals in middle America, and they say they're operating at 20 to 30% of normal operating revenue due to this coronavirus response, due to all the fear keeping people out of hospitals, due to elective surgeries being canceled, so on and so forth. And as we're seeing at Palo Alto Online, published on Friday, April 24th, Stanford Health is cutting its workers' wages by 20%. Okay, all over the country, folks, doctors are getting their hours cut. Doctors, nurses, healthcare providers, hours cut, wages cut. And the health and well-being of all patients, well, is arguably suffering. In my personal opinion, if you want to live a long, healthy, happy life in the black from an economic perspective, you should do everything you can to avoid going to the doctor, to avoid getting sucked into the sick care system. That's my personal opinion. But at the same time, there are a lot of people out there who, whether because they're elderly or they didn't take good care of themselves or just plain bad luck, have been, they have to go to the doctor. And a lot of these people can't go to the doctor because hospitals are not seeing normal patients because they are completely overreacting due to the coronavirus scare. Employees at Stanford Healthcare, including doctors, nurses, and technicians who are caring for COVID-19 patients, will have their pay reduced by up to 20% starting Monday, April 27th, my birthday, for 10 weeks, according to a tip sheet the organization sent to workers on April 21st. The medical center briefly stated it was making the cuts due to the economic impacts of COVID-19 on the organization instead of laying off employees. The temporary workforce adjustment program was created as part of the hospital's cost-saving measure and initiatives, hospital administrators stated. The pay reductions will apply to all employees at Stanford Hospital, Lucile Packard Children's Hospital, and in the East Bay Stanford Valley Care. Asked if the cuts included to doctors' salaries, hospital spokesman Lisa Kim reiterated the cuts are across the board. Employees were stunned by the announcement. The pay cuts will be an economic burden for many employees, said Linda Cornell, a 40-year employee and unit secretary who works at a nursing station as a sort of air traffic controller for the unit. There's also concern it could affect patient care, she said. It's just crazy. The governor was saying that we have the highest death rate of COVID-19 patients yesterday, and here they want to cut staff. I've never seen anything like this, she said. Stanford Hospital CEO David Entwistle has indicated in earlier news reports that emergency room visits at Stanford Hospital is down 40%. Hospital spokeswoman Leah Kim said. In a statement, Stanford said in part, Stanford Healthcare is navigating the unprecedented economic impact of COVID-19, and as part of this effort is implementing a temporary reduction in hours across the organization. The current pandemic has affected many organizations globally, and we are no exception. This is a difficult but necessary decision to sustain the long-term health of what? The organization, so we can continue to provide critical services to the community. Okay, Hospitals guarding their bottom lines more than the health and well-being of their patients or their employees. Hospitals such as Stanford have shut down elective surgeries, a large source of revenue, under a state mandate to prepare for the surge of COVID-19 patients. But on Wednesday, Governor Gavin Newsom relaxed some of those restrictions, allowing for procedures such as heart valve replacements, tumor removals, and colonoscopies. Cornell said she hopes that more elective surgeries can be allowed to come back online and that they would ease the economic strain on the hospitals. In the meantime, many employees will face economic hardship. It goes on and on. You get the gist of it. But the whole point is the whole situation stinks. Even the healthcare system, we were told that we needed to shut down the world economy to protect. We were told we needed to make everybody stay in their homes, shut down all businesses so we could avoid overwhelming healthcare. Well, now healthcare is being overwhelmed by a crisis of unprecedented proportions. They're not making as much money as they need to keep sick care rolling. Okay, I had a friend. Again, people come at me on a personal level. I had a ex-girlfriend come at me the other day because she was offended that I was talking about healthcare when I'm not a healthcare provider. And she told me that I should consult Time magazine. So I did. Latest from Time magazine, Governor Cuomo says preliminary antibody testing indicates far more New Yorkers had coronavirus than previously believed. We're seeing all sorts of antibody tests coming out all over the world. A good example of that one I started the show off with the prisoners, where approximately 70% of the prisoners tested, 70% of 4,000 some prisoners tested had coronavirus, and 96% did not have symptoms. Okay, we know about this survey. So I highlighted a little here, but I was told I should consult Time magazine, and let's do that. Another 438 people were killed by the virus in the state Wednesday, bringing its total death toll to more than 15,700. That number doesn't include more than 5,100 other deaths in New York City that were believed to be caused by the virus but haven't been confirmed by a lab test. So, Time magazine blatantly lying to us, okay? They're saying that the statistics coming out of New York do not include presumed or probable cases of coronavirus. As we're going to see, this is total bullshit. We can just, 5 minutes of research on the state of New York's own public health websites will show us that Time magazine is not a reliable source of information. And, they're doing this, they're putting this out here like, well, they're leading people to believe that New York State, that the CDC, that, where these disease outbreaks are most severe, we're undercounting. They're saying there's an undercount and that they're not counting folks as COVID deaths if they were believed to be caused by the virus but have not been confirmed by a lab test. So there's your Time magazine. Thanks for joining us. Looking at the New York State Department of Health, this is information for physicians and other medical professionals. COVID-19 coronavirus certifying deaths, decedent handling, and funeral information. The New York State Department of Health Bureau of Vital Records, in concert with the Bureau of Funeral Directing and Centers for Disease Control, I'm gonna zoom in so y'all can know that I'm reading what's on the website, is sharing state and federal guidelines for certifying death records, handling descendant bodies, that means dead people's bodies, where the cause of death is confirmed COVID-19, and performing disposition events. The guidelines are as follows. When certifying a COVID-19 death, include the literal COVID-19 in Part 1 of the cause of death section. Please refer to the updated CDC guidance for certifying coronavirus COVID-19 deaths. Okay, April 2nd, 2020. We click on that. Where does it take us? It takes us to this same PDF that I have picked apart repeatedly on the show here. The vital statistics reporting guidance for certifying deaths due to the coronavirus disease, brought to you by the CDC. Okay, and as you can see quite clearly here, if you scroll down, let's see, where is it? Conclusion. An accurate count of the number of deaths due to COVID-19 infection, which depends in part on proper death certification, is critical to ongoing public health surveillance and response. When a death is due to COVID-19, it is likely the underlying cause of death, and thus it should be reported on the lowest line used in Part 1 of the death certificate. Okay, so they're saying right there, if somebody dies and they have COVID-19, it is likely the underlying cause of death. It should be reported on the lowest line used in Part 1 of the death certificate. Ideally, testing for COVID-19 should be conducted, but it is acceptable to report COVID-19 on a death certificate without this confirmation if the circumstances are compelling within a reasonable degree of certainty. Catch all that? So if a doctor feels like somebody was exposed to COVID and they had symptoms that were indicative of COVID and they died, there's no need to test them, and they can have COVID-19 listed as their cause of death. Okay. And it goes on and on. You should read this because it just, if you read between the lines here, it is really pushing docs to list COVID as the cause of death. They even give you some examples of how to do this. Here's a woman with no testing. Although no testing was done, the coroner determined that the likely ultimate cause of death was COVID-19, given the patient's symptoms and exposure to an infected individual. Therefore, COVID-19 was reported on the lowest line used in Part 1. Her stroke, which had rendered her non-ambulatory, meaning she wasn't able to walk. She hadn't been able to walk for the last 3 years. Her stroke and her non-ambulatory status was considered a factor that contributed to her death, but was not a part of the direct causal sequence. So COVID-19, probable COVID-19 death right there. There it is again. Now, picking apart Time magazine led me to the New York State Department of Health COVID-19 tracker. And if you look here, you can see the yellow line are total new positive test results for COVID. And if you look at this, you just look at the yellow, you say, it looks like they're having another spike in New York. It looks like they had started to flatten the curve. It looks like they were flattening the curve, but now they're having a spike of new cases, right? Because if you look from April, there was a little blip up on April 12th, 13th, 14th, and then it's been steady decline until around the 20th. But now it's on the rise again. But look at this. Okay, look at the blue lines. The blue lines are the total number of persons tested. And you can see on April 22nd and 23rd, now I can go hover here. They tested 46,912 people. To put that into perspective, on April 8th, when we were seeing a spike in the peak there, 23,000. So they tested twice as many people on April 24th as they tested on April 7th. Twice as many people. So there's a huge increase in testing going on in New York right now, which is obviously going to result in more positive test results, especially when you consider the fact that, let's just look at those statistics from the prison system. 70% of prisoners tested positive, and 96% had no symptoms. Okay, it stands to reason that if they test twice, 3 times as many people in New York, they are going to have more positive test results come in. And you can look here at the beginning here. Check this out. If you look at early March, whoa, it's refreshing on me. What's going on here? This is giving me the last week. I want all data. If we look here, you can see too, if you look at early March into March, this entire curve, the blue line, closely matches the yellow line, meaning as they do more testing, they see more positive cases, especially early on when we were getting convinced that this was serious, that it was on the rise, that we had to flatten the curve, that we had to shut down the global economy. You do more tests, you're going to come up with more positive test results, and the curve is going to be skewed. Looking at the New York Department of Health total fatalities, you can see, according to the New York Department of Health, the grand total fatalities with COVID listed as the cause of death is 16,599. Let's compare that real quick with the Johns Hopkins Event 201 Global Real-Time Fear Porn Unreliable, statistically biased, questionably sourced global doom fear map. And if we look at the USA and then we look at New York, come on, 17,126 deaths attributed there on the doom map compared to 16,599 according to the New York State Department of Health. So they're close, but it's important to look here, the top 10 comorbidities by age group. Okay, down at the bottom here, we're seeing 14,790 of the 16,599 coronavirus deaths listed in New York. Of those numbers, 89.1% had at least one comorbidity, meaning one more serious medical condition. And if we look at this, you can see grand total, almost 10,000, 9,524 of those folks had hypertension. So, more than half had hypertension. 6,195 diabetes. 3,489 hypolipidemia, 2,000 coronary heart disease, 1,915 dementia, renal diseases 1,823, COPD 1,349, atrial fibrillation, cancer, and stroke, rounding it out for the top 10. And if you look through the data here, you can see that most of the people dying, it groups it by age too. Most of the people dying are over 60 and they have other serious medical conditions. Many of these medical conditions quite avoidable if you take moderately good care of yourself. So is it really worth shutting down the entire planet, putting hundreds of millions of people into poverty and other totally preventable serious public health issues in order to save us from a disease where, if we can trust that's out of the prison population, something like 96% of prisoners don't have symptoms. And in these prison systems, 70% are testing positive. What are we doing? What are we doing? Interestingly, one thing that they're doing is trying to get us to sign off on giving up a lot of our freedoms and putting a lot of our hope into a vaccine. The world leaders launch a plan to speed the COVID-19 drugs and vaccine. The U.S. stays away. Why is the U.S. staying away? Because the World Health Organization is leading the charge. Who is the biggest funder of the World Health Organization? That would be the Bill and Melinda Gates Foundation, the same people that have the Gavi Global Vaccine Initiative. World leaders plan, I would add, Bill Gates is heavily invested in the vaccine industry. The vaccine industry profits to the tune of $59.2 billion annually. Excuse me, that's revenues, global vaccine market revenues. Okay, you might notice here, there's a kind of a trend in global vaccine revenues. They have almost doubled in the last 6 years. Turns out there's big money to be made off of trying to vaccinate the entire planet for a whole host of diseases. Anyway, it's important to note, we all know Trump canceled U.S. funding to the World Health Organization, but French President Emmanuel Macron, German Chancellor Angela Merkel, and South African President Cyril Ramaphosa were among those who joined a video conference to launch what the World Health Organization billed as a landmark collaboration to fight the pandemic. The aim is to speed development of safe and effective drugs, tests, and vaccines to prevent, diagnose, and treat coronavirus 19, the lung disease caused by the novel coronavirus. And of course, to ensure equal access to treatments for rich and poor. If you read between the lines on that, That means they want to make drugs and vaccines available to poor people, the same poor people who are literally starving to death. Can't get them food, can get them vaccines. We must make sure that people who need them get them, said Peter Sands, head of the Global Fund to Fight on AIDS, tuberculosis, and malaria. The lessons from AIDS must be learned. Too many millions died before antiretroviral medicines were made widely accessible. A spokesman for the U.S. mission in Geneva had earlier told Reuters that the United States would not be involved. Although the United States was not in attendance at the meeting in question, there should be no doubt about our continuing determination to lead on global health matters, including the current COVID crisis, he said by email. We remain deeply concerned about the World Health Organization's effectiveness, given that its gross failures helped fuel the current pandemic, he later said. Gross failures, indeed. Gross failures on all levels. I got to go pee. Read those. You can see Merkel pushing for vaccines. No surprise there. Thank you for your patience. And of course, they're pushing the vaccines. As new diagnostics, treatments, and vaccines become available, we have a responsibility to get them out equitably with the understanding that all lives have equal value, said Melinda Gates, co-chair of the Gates Foundation, which was the World Health Organization's second largest donor last year. Now, the Gates Foundation is the largest because the U.S. has bowed out. More than 100 potential COVID-19 vaccines are being developed, including 6 already in clinical trials, said Dr. Seth Berkley, CEO of the Gavi Vaccine Alliance, a public-private partnership that leads immunization campaigns in poor countries. Okay, little nugget of truth there. Thank you, Reuters. It's a public-private partnership. Okay, public being governments, public being NGOs like the Gates Foundation, which heavily supports Gavi, public being Gavi itself, an NGO, private being these massive pharmaceutical companies that profit off of sick people. We need to ensure there are enough vaccines for everyone. We are going to need global leadership to identify and prioritize vaccine candidates, he told a Geneva news briefing. Okay, goes on and on. This guy, senior legal and policy advisor for Médecins Sans Frontières, Medicine Without Borders Access Campaign, welcomed the pledges, but called for concrete steps. There shouldn't be any patent monopoly and profiteering out of this pandemic, she told Reuters. But there's going to be, because we live in a profit and power-driven world. The Guardian picked this up as well. U.S. stays away as world leaders agree action on COVID-19 vaccine. There's Macron, a man who is so sketchy his entire country is literally up in arms calling for his removal. But apparently he's qualified, along with Billy Gates, to decide what humans should inject in their bodies to keep them safely. World Health Organization warning that we have a long way to go in the coronavirus crisis. We can't really trust the World Health Organization, so take that with a huge grain of salt. And CNN, again, this is that same headline I started off with. They spun it their own little way here. World Health Organization also telling us there's no evidence showing that having coronavirus prevents a second infection, despite the fact, as we saw at the beginning of the show today, that, when you get the coronavirus, your body fights it naturally, like it does with the flu, like it does with the common cold, like it does with a whole host of viral and bacterial and fungal infections, right? And you develop antibodies. And the reason the antibody tests work is because your body has developed antibodies. And one great thing about antibodies is they help make you more immune. Do they give you perfect immunity? No. But do they help you have a less severe reaction the next time you're exposed to a virus? Yes. Yes, they do. So file this away under fear porn bullshit. In the midst of it all, okay, now picking on the World Health Organization, now we're picking on the United States government. The U.S. airstrikes hit all-time high as coronavirus spreads in Somalia. Right, we're told that the federal government cares so much about human health and well-being that they had to shut down the entire planet, crash the global economy, put us all under medical martial law, lock up most Americans under stay-at-home orders, and so forth. But at the same time, they're literally out there bombing people, killing people for power and profit. In the first 4 months of this year, U.S. Africa Command has conducted more airstrikes in Somalia than it did during all of Barack Obama's 8 years in office. There we go. Since the beginning of the year, AFRICOM has announced 39 airstrikes in Somalia. The command announced a total of 36 such strike attacks from 2009 to 2017 under Obama, peaking in 2016 with 19 declared airstrikes. It's important to note here, they're spinning this like Obama was less of a warmonger than Donnie Trumpo. But Obama was taking out Syria. He was taking out Libya. He was, starting fights with North Korea and Iran, continuing the endless war of terror in Afghanistan and Iraq, funding ISIS. There's more airstrikes in Syria now, but the total number, or not Syria, in Somalia now, but the total number probably has not gone down. How Africa risks reeling from a health crisis to a food crisis, no big surprise there. The global economy shutting down, people are losing their jobs, food systems struggling. Back to Time magazine to keep my ex-girlfriend happy. It's a bucket grade on a 5-alarm fire. Food banks in the U.S. here struggle to keep up with skyrocketing demand. No big surprise, okay? People have lost their jobs. How many people? On April 23rd, new unemployment numbers showed another 4.4 million people filed unemployment claims last week, bringing the total since March 14th to more than 26 million. Okay, 26 million unemployment claims. That is just a fraction of the total number of jobs lost because a lot of people don't file for unemployment. A lot of people haven't lost their jobs. For example, this woman here that they're basing this article around Quarles did not lose her job completely. Her reduced hours may make her eligible for partial unemployment insurance. Okay. So yeah, a lot of people filing for unemployment, but a lot more people not filing for unemployment or having their hours cut or their pay cut, like we're seeing in the medical profession itself. The whole situation stinks. U.S. reels toward meat shortage. The world may be next. It says, what paper is this? It's a Bloomberg, just a Bloomberg reprint. The Press Herald. Where is the Press Herald from? Sorry. Got to stay on top of this stuff. That's a Bloomberg reprint. Clearly a mainstream paper. It's funny, you go to these mainstream paper sites and they don't even tell you. Portland, Oregon. There we go. Portland Press Herald. Important to note, too, as you can see in the crawler there, 3, social isolation and stress are more deadly than COVID. Coming from the UPI published on April 24th, 2020, 20% of children on lockdown in China suffer depression and anxiety, study finds. We all know that when your body is stressed, the stress response, which can be very healthy if you're being chased by a jaguar or you have to fight for your life against a mugger in an alleyway, the prolonged excitation of the stress response, it results in elevated levels of cortisol, the stress hormone, in your bloodstream, which decreases your overall health and your immune system's ability to fight infections like the coronavirus. April 24th, UPI, as many as 1 in 5 children in China confined to their homes because of the COVID-19 pandemic suffer from depression and anxiety, suggests new data published Friday. And experts say the socioeconomic differences in the United States may only accentuate these issues, meaning we might have it worse in the U.S. because of socioeconomic shit shows here in the United States. They surveyed 1,800 students and found that roughly 20% reported depression or anxiety or both. Dr. Margarita Alegria, chief of the Disparities Research Unit at Massachusetts General Hospital in Boston, said during a conference call with reporters that in the United States, where there is greater income inequality, these problems could be more pronounced. The poverty that we have and the inequities might make it even harder for people because they may not feel they are being treated equally, she said. I'm not sure that was the case in China. Children in minority communities in the United States, the lady added, may be experienced particularly vulnerable given some of the economic hardships experienced by these families in general, which may have been made worse by the pandemic. Okay. Full stop here. They always blame the pandemic. They don't blame the official response. They don't blame the absurd overreaction. They don't blame the intentional crashing of the global economy. Moving on. Nearly 30 million Americans have filed for unemployment since the start of the outbreak across the country, and research in many cities indicates that minority communities may be most adversely affected, both by COVID-19 and its economic effects. COVID-19 pandemic and social distancing implemented to mitigate it have had an effect on mental health across the country. NAMI has reported a 40% increase in calls to its helpline since the start of the outbreak in the United States. Okay, 40% increase in calls. A lot of people don't call for help, just like a lot of people don't go to the doctor when they get sick. Important to note again, we just talked about children suffering the risks of social isolation. According to Amy Novotny, published at the American Psychological Association in May of 2019, the effects are quite severe. According to a 2018 national survey by Cigna, loneliness levels have reached an all-time high. Well, I think they're higher now, with nearly half of 20,000 U.S. adults reporting they sometimes or always feel alone. 40% of survey participants also reported they sometimes or always feel that their relationships are not meaningful and that they feel isolated. Such numbers are alarming because the health and mental health risks associated with loneliness. According to a meta-analysis co-authored by Julian Holt Lunstead, PhD, a professor of psychology and neuroscience at BYU, lack of social connection heightens health risks as much as smoking 15 cigarettes a day or having alcohol use disorder. She's also found that loneliness and social isolation are twice as harmful to physical and mental health as obesity. There is robust evidence that social isolation and loneliness significantly increase risk for premature mortality, and the magnitude of the risk exceeds that of many leading health indicators, Holt Lunstead says. Goes on and on. A couple more studies. Last year, research at the Florida State University College of Medicine also found that loneliness is associated with a 40% increase in a person's risk for dementia. Led by Angela Sutton, PhD, the study examined data on more than 12,000 U.S. adults ages 50 years and older. Participants rated their levels of loneliness and social isolation and completed a cognitive battery every 2 years for up to 10 years. The 2015 study led by Stephen Cole, MD, a professor of medicine at the University of California, Los Angeles, provides additional clues as to why loneliness can harm overall health. He and his colleagues examined gene expressions in leukocytes, white blood cells that play key roles in the immune system's response to infection. They found that the leukocytes of lonely participants, both humans and rhesus macaques, showed an increased expression of genes involved in inflammation and a decreased expression of genes involved in antiviral responses. Did you catch that? So being lonely, being socially isolated decreases the effectiveness of your immune system. Loneliness, it seems, can lead to long-term fight or flight stress signaling, which negatively affects immune system functioning. Simply put, people who feel lonely have less immunity and more inflammation than people who don't. And what's killing people in the instance of COVID? It's inflammation. Why are people succumbing to it? Because they lack immunity. What contributes to inflammation and a lack of immunity? The heightened stress response. And what causes the heightened stress response? Loneliness, social isolation, uncertainty, fear, poverty, and a whole shitload of other stuff. It's not rocket science. This is another article from 2017, just confirming from Oxford Academic. This is that Julianne Holt Lunstead study that was cited in that Psychology Today article. So I'll paste that one in. You guys can check it out if you feel so inclined. Teresa Hunger. What's up, Teresa? She says, obviously, you need to go back and watch CNN. I don't know, Teresa. It was good that David called me yesterday. Hunger Man called me up yesterday. Cool to see. Teresa, thanks for tuning in today. Much appreciated. Let's see. What else do we got here? Oh, I just closed it out. I had a Wired article up there. Shepard Humphreys has been sending me a study, and I'll share that in the links too. Although the wording, this is a good example of how statistics can be skewed both ways. I appreciate Shepard and his perspective and the work that he does. But I took his survey. It's a Google Docs survey, and you can see the results overwhelmingly supporting getting back to work and getting states to return to normal by May 1st. But, to be honest, the survey is very, the wording in the survey is very skewed. And of course, any statistics. Now, I'm not attacking Shepard here. He's doing his own thing. I'm probably not going to share that survey just because I'm trying to keep it as factual as possible. And it works both ways. You can see statistics getting flipped on their heads by folks saying that the coronavirus is the most deadly thing we've ever experienced. It's worse than the Spanish flu. You don't get it. Your antibodies are not going to make you any more immune. We're all going to die. Holy shit, we need a vaccine. Bill Gates, please save us. You got that perspective. And you got the other perspective, which is more in line with mine, but I also don't want to mislead people, right? But this just goes to show, if you take a survey and you share it, if you word it in such a way, and you share it only with people that share your perspective, you're going to get severely skewed statistics. It works both ways, whether people are in favor of Bill Gates vaccinating the entire world, or people are in favor of freedom. I'm in favor of truth. I'm in favor of trying to keep it as real as possible. And on that note, I'm signing off. I got a big day today, despite the rain. I'm going to take off this suit. I got my friend Jasper here. I'm going to help him out working on his van. My friend Sprout's coming down. We're going to work on project for her garden, getting those victory gardens going, because we are all in for the long haul, my friend. This is one of those situations that's going to be with us for decades to come. Remember, poverty kills. Poverty kills. We're all like Miss Pac-Man out there. We all got to chase those power pellets in order to get by. We're all being chased by the ghost, the specter of poverty. That's the system that was created and foisted upon us. And now the same people that profit so handsomely from that system are using their positions of power and influence to profit handsomely still, while simultaneously implementing policies that are resulting in the impoverishment and the social isolation of hundreds of millions, if not billions of people all over the planet. Poverty kills. Social isolation kills. Tyranny kills. Doesn't get any more simple than that. One good piece of news, though, the coronavirus only kills a very small percentage of the people who catch it. And most people that catch coronavirus, perhaps as high as 96%, if we can trust statistics coming out of the prison system in various American states, a large percentage of people that have been exposed to the coronavirus have very mild or no symptoms whatsoever. And of the people that do have severe symptoms, only a small percentage of them die. And the vast majority of those people that do die are elderly, infirm, or they have other serious medical conditions that they're dealing with, they're contending with simultaneously. Another piece of good news, the official statistics are cooked, okay? The official death rates, the official statistics about the global prevalence of coronavirus are cooked. And even despite the fact that these numbers have been cooked, not that many people have died. 203,000 people worldwide. That amounts to 2.6 people out of every 100,000 people on the planet. Don't believe the hype. Remember, mainstream media is specifically designed to distract us, divide us, deceive us, deter us from taking positive action, and depress the living shit out of us. What can you do? Take care of yourselves and the ones you love. Remember, the media you eat, the information you expose yourself to, is just as important to your overall mental, physical, and spiritual health as the food that you eat, as the things you do to take care of yourself. How can you avoid the coronavirus? How can you stay healthy? Stay hydrated. Get enough sleep. Avoid genetically modified foods and pesticides. Try to eat healthy. if you can. There's so many things we can do. Hit those vitamin supplements, right? Hit those natural herbal remedies that have been around for literally thousands of years. And my advice to you, this is not medical advice, this is life advice. Do everything you can to stay out of the sick care system. Because just like the legal system, just like the prison system, just like the taxation system in this country, they're all designed to control you, keep you in line, and they're all pretty expensive too. I'm out. I love all y'all. Have a great day. Peace.